Welcome, Professor. Thanks for your time this morning.
Thank you very much for having me today.
So it's not an easy topic to discuss, but we've got to be very realistic about it. The World Health Organization has predicted a sharp increase in the near future in cancer cases. Why is it?
Well, you know, it's one of those difficult things that it's difficult really to predict why or to state a specific reason. But I can tell you that lifestyle plays a major role in many of the various cancers. And we know that the colon cancer that you refer to, one of those lifestyle cancers, that lifestyle really plays a very important role.
And yet we've been looking at and exposed to awareness campaigns for quite a number of years now. It's not that South Africans are unaware of the risks attached to certain lifestyle behaviors. Is access to treatment and screening and diagnosis also a problem in terms of cancers being caught too late?
You know, it's multifactorial. Yes, there is a major problem with access to healthcare in South Africa, especially the 80% plus of the population that are dependent on the public health service. And we know that they're not doing very well. So about 16% of the population have access to health insurance. So they are well covered and they get of the best treatment in the world. But my heart goes out to those people, the 80% plus of the population, who have no access. And that is one side of the story. Then the other side of it is that we all believe it won't happen to me. It will happen to somebody else, because you hear of so-and-so and you hear of so-and-so being affected. And we don't believe that it's going to come our own way.
And it's not that we don't have adequate or adequately trained medical professionals. We have some of the world's best cancer specialists working in our government hospitals, but unfortunately there's just not enough resources to go around, and patients often find themselves waiting up to 6 months for treatment to start. What kind of impact does that have on the treatability or the success of treatment?
Well, you specifically mentioned it in your introduction, saying that stage 4 cancers are becoming the everyday occurrence, because people don't have access when they really need it. And then there are other factors like very often there's a myth about it. There's maybe a thought of witchcraft connected to it. And that is why people don't come forward, and they delay coming forward. And then the cancer keeps on developing. And by the time that they really become very ill and they come forward, we find that they're stage 3 and stage 4, which makes treatment very, very problematic and very difficult.
But that's only talking about the population that have access to urban area medical centres. There's lots of the population that live in rural areas where they have absolutely no access even to go for screening should they wish to.
Yes, you know, I always refer to rural and far rural, because the Cancer Association, we have mobile clinics that goes out to rural, and sometimes we manage to get into far rural areas. And if you see the health problems that people have to live with there, it is absolutely heartbreaking. And then we go out and we will provide some screening services. Then you go back and the people fall through the cracks. You never find them again to come up with a diagnosis and to come up with a referral, so that they will eventually, hopefully, reach a health centre where they'll be treated.
To go back to that mentality of it's not going to happen to me, at what age is it realistic? Because let's face it, screening is not free everywhere. In some cases you do have to pay for it depending on your medical cover. When should people look at it as an absolute necessity? Is it age bound? Is it bound to gender, race? What are the things that make you a candidate sooner than other people?
Again, the situation is totally different for each of the different cancers. But if we talk prostate cancer, and here's a very concerning story that I want to tell you. In the last fortnight, there was research made available, and it was research done worldwide, with an indication that prostate cancer is now becoming a problem in early adulthood and late adolescence. Now, we haven't seen that happening in South Africa, but it's happening elsewhere in the world. Where we previously believed that prostate cancer was a disease of men 50 years and older, They even referred to the prostate gland as the old man's gland.
Yes.
And now we're seeing more and more people of age 40. And if we hear the research, now even under 40 and even into late adolescence. And that is so concerning. Why is this happening? And we don't know whether it is behavior, whether it is environmental factors, that we're living in a toxic soup, that there are so many toxins and cancer-causing chemicals around us, which we still haven't maybe tested even, and that they could all be involved in this very complex problem of health that we are experiencing at the moment.
Right, and while we're absolutely at the mercy of medical researchers who are looking into the reasons for the increase in cancer, the first step that we can take is being aware and going for regular screenings, making sure we follow up on health care, and that's something we're focusing on. Thank you very much for your time, Professor
Thank you
Haupt.
very much for having me.
Thank you.